Hi, my name is Lidija and I'm the president of HEMA-ONKO in Macedonia and the newly appointed ambassador of Noel for Eastern Europe. I'm here to talk about the benefits of support groups and how effective they are. Support groups are incredibly valuable, especially in our region, where community and mutual support are very important. Yet discussing personal health issues like cancer is often surrounded by stigma and silence. For patients with ALL and other blood cancers, these groups offer a safe space to connect with others who understand their journey. In Macedonia and across Eastern Europe, many people feel isolated because they are reluctant to share their diagnosis, even with close family and friends and colleagues, due to a sense of feeling of shame, confusion, fear of being judged, and also being let go from their jobs, because 85% of the time across this region in the private sector, this is what occurs. This makes patient organisations and support groups very essential. They provide not just a practical advice, but also much needed sense of belonging and understanding from others who have faced similar experiences. Not feeling judged, as well as sometimes among strangers, they feel safer. But where we have also seen friendships grow during our groups. Another significant issue we see is also with family members, caregivers, who often make decisions on behalf of patients. And in many cases, patients are not even fully informed of their diagnosis because family members hide the details to avoid scaring them. They feel it's better if they just don't know the full extent, even whilst on therapy. The healthcare professionals here in Macedonia and very much so in Eastern Europe, they go along with this approach. And while the approach is well-intentioned, it places an overwhelming burden on the family members and the caregiver, leaving them without support and carrying a very heavy emotional load. Many organisations across our region and our own HEMA-ONKO also offer support to these family members and caregivers, understanding that their well-being is very crucial to patients' care. I personally understand the importance of support from my own experience as a caregiver for my mother, who had CLL and another condition. At that time, and this is 15 years ago, I had no one to talk to and didn't even know that patient organisations exist. And this is in a country like Australia, where there are way more resources than here in Eastern Europe. And from this experience, I believe strongly that healthcare professionals should always inform their patients about the existence of a patient organisation. Having access to support can make a significant and really huge difference in managing the emotional and practical challenges of a diagnosis for patients, the family members, and their caregivers. And that's why we've seen that it's very, very beneficial having patient organisations in this region. Thank you for your time and letting me share a little bit about why it's important of having a patient organisation. Thank you.